Hi, everyone. This is a case presentation for osteomyelitis. TC is a 46-year-old female who presents to your primary care office for a follow-up appointment. TC was recently in a significant motor vehicle accident and was seen in the emergency department after the crash. On initial presentation, she was found to have extensive injuries, including an open left humerus fracture. She underwent surgery for repair of the fracture and recently had the cast removed. Ultimately, she was doing well, but has had residual left elbow pain. 3 days ago, TC developed fevers and began feeling generally unwell. Her elbow pain worsened and she noticed swelling to the joint. On exam, the left elbow is mildly edematous, warm to touch, and she has pain with range of motion. She's febrile to 113 and appears fatigued. You run a basic metabolic panel, complete blood count, erythrocyte sedimentation rate, C-reactive protein, and blood cultures. Her white blood cell count is slightly elevated to 13.1. Her CRP is elevated to 9.2, and her ESR is 65. The CRP and ESR are inflammatory markers, and their elevated values are indicative of an acute infection. The elevated white blood cell count further confirms this, but unfortunately, these values could be elevated for a number of different reasons, and they're largely unspecific. Based on her clinical presentation, laboratory findings, and recent hospital course, TC is diagnosed with osteomyelitis. You also order a CT scan of the extremity to look for the extent of bone involvement. Due to the recent surgery and presentation, TC will be treated with broad-spectrum IV antibiotics until blood cultures result to narrow the course. Staph is the typical culprit for osteomyelitis, so you can expect to treat with vancomycin and cefazolin for 6 to 8 weeks. I hope this was helpful, and I'm happy to answer any questions. Thanks.